Hi, my name is Katrina IM, and I'm going to go over an IM injection. Okay, so first thing we're going to do is we're going to verify the physician's orders. Then I'm going to go into the med room and I'm going to draw up the medication. Okay, so we have an order for 4 milligrams of Halidol PRN for agitation, and the vial has 5 milligrams in it. So what we're going to end up drawing up is 0.8 milliliters because it needs to be given in milliliters. So I've got my syringe. It has a 22 gauge needle on it to draw up, and then we're going to switch needles to a 25 gauge for IM injection, and that's 1 inch long. So what we're going to do is we verified the orders in the MAR. Now we're going to we're going to get our medication, and it's a vial, so we're going to go ahead and scrub our hub for at least 15 seconds to make sure it's nice and clean. And then we're going to draw up 0.8 milliliters of air, and remove this cap very carefully, and we're going to insert into the vial and push that air in. Now we're going to draw up our 0.8 milligrams. Okay. Now we're going to recap, and we are going to switch needles. Okay, so this gets in the biohazard container, and we now have our 25 gauge 1 inch needle to give the actual injection. Now I'm going to go into the patient's room, and I'm going to identify myself. I'm going to ask the patient to identify themselves using their name and date of birth. I'm going to check the order for the medication one more time at bedside, and I'm going to perform hand hygiene, and I'm going to don some clean gloves. For the IM injection, I can use the deltoid, the vastus lateralis, the ventrogluteal, and the dorsogluteal. So for today's injection, we're going to use the deltoid. And when doing an IM injection, you need to make sure that you use the Z-Track method. What I'm going to do first on the patient is I'm going to clean the site with alcohol. And after I do that, I'm going to remove the cap, and I'm going to use the Z-Track method to push against the muscle and push it over. And now I'm going to put my needle in at 90 degrees, and I'm going to aspirate, and as long as there is no blood, no blood, we'll go ahead and inject. And we're going to inject at a rate of 10 seconds per milliliter. So we'll inject this just under 10 seconds. Okay, and so we've done that. Now we're going to remove this, put this in the biohazard container. We're going to use alcohol swab to wipe. And I'm going to remove my gloves, perform hand hygiene, and I'm going to document the medication given, the site that it was given at, and how the patient tolerated. And that's all.